Welcome to Faculty Insight, brought to you by Harvard Extension School in partnership with ThoughtCast. I'm Jenny Attia, and I'm speaking with Gene Heyman, a research psychologist at McLean Hospital, a visiting associate professor at Boston College, and also a lecturer in psychology at Harvard Medical School and Harvard Extension School. Gene Heyman, you've recently written a book called Addiction, a Disorder of Choice. It's proven to be rather controversial. Why the controversy?
The controversy has to do, I think, with people's understanding of choice and their understanding of addiction. And for many people, and I think most of the public, those two terms don't go together. They seem contradictory.
When I think of the word addiction, it immediately makes me think of something you do not control.
Right.
You can't stop it. If you could, it wouldn't be an addiction.
Precisely. And if you look in the dictionary, addiction means against one's will. It's compulsive. And when I started reading the literature, I ended up with a very different picture of addiction than the one I started with.
How do you define addiction now, Gene?
My definition, I just take the American Psychiatric Association definition, and that is the persistence of drug use despite aversive consequences.
Gene, your choice model of addiction flies in the face of the conventional thinking, though, which is called the disease model.
Yes.
In fact, there is a genetic predisposition in some people.
Right. So there's just like there's a genetic predisposition to be a piano player, to be a baseball player. Doesn't mean you have to be. People come into the world with talents that push them in one direction or the other, or liabilities that push them in one direction or the other. We're not blank slates. We come in with all of these predispositions, and one of the predispositions influences drug use.
It seems that you're distinguishing between predisposition and predetermination.
Yes, I am, and I think that's the case for virtually all genetic influence traits. I frame the issue in terms of the nature of behavior. So then I ask the question, to what extent are psychiatric disorders influenced by things like people's opinion, by concern about employment, about concern about legal consequences, about respect from your children or your parents? And if we look at something like schizophrenia, if we look at those symptoms, we are going to see that we can't influence them by saying, well, this will embarrass your children if you're hallucinating. That won't stop someone from hallucinating. However, if we look at drug use and addicts and we ask what are the factors that influence them stopping, it turns out that one of the main things that we see is their concern about their children, what their parents think, their concern about employment. These are the factors that influence people's drug use for people who meet the criteria for addiction. So that's what I mean by choice, activities that can be influenced by costs and benefits.
What about the brain, though, being affected by drug abuse? There are changes in the brain from drug use that are not for the better.
The reason in general why drugs can change the brain, it's not because evolution was pushing, thinking about drugs in the future, but that everything changes the brain. And so the brain is this very plastic organ, and everything changes it, and yes, drugs change it too. And there are two questions. Are the changes residual? That is, do they persist? And do they persist in a way that prevents the individual from responding to the consequences of their behavior? And to answer that question, we have to look at how addicts behave.
And I think one of the key points of your book, Gene Heyman, is that most addicts quit. That's not something I think that's very well known.
Right, and this was something that I certainly was not aware of, and I think most of my colleagues are not aware of. And one of the reasons I wrote the book was to inform my colleagues as well as the public. Addiction is presented as a chronic relapsing disease, and of all the psychiatric disorders, it has the highest remission rate. Every study shows that.
But of course, there are people who do not quit, and they can lose their jobs, their homes, their children, even their lives. Did these people have the choice to quit also?
There are some data, and in the book I look at every study I can find on the distinction between those who quit and those who do not. And the basic factor is the presence of additional disorders, either medical Non-psychiatric medical disorders or psychiatric disorders. And that is a big difference, and I think that is what keeps most people, keep using drugs and not quitting.
Last question, Gene Heyman. Why does it matter that you determine the meaning of addiction, whether it's a choice or a disease?
I think it matters in terms of how we understand each other, just person to person. I think it matters in terms of how we think about planning for treatment and policy. It has come, I think it's going to really matter a lot when we think about whether or not people who meet the criteria for addiction should be covered by health insurance to the same extent as something like diabetes or cancer.
What do you think?
Well, my impression is that we need some other category. We need a way of thinking about disorders in which the individual's own activity makes a big difference in whether or not they keep showing the symptoms. So I'm not saying that addicts do not need treatment. I think that they're often in situations where there's an intervention needed. But that doesn't mean it needs to be based on a medical model.
Great. Thank you so much, Gene, for your time.
Well,
I really appreciate it.
This has been fun. Thank you.
You've been watching Faculty Insight, a series of interviews brought to you by Harvard Extension School in partnership with ThoughtCast. I'm Gene Heyman. Thank you for joining us.